Today's the day I've been waiting for 3.5 years, where we take this face and we do whatever we want to it. It's gonna be fun AF. So we are marking out this little incision here for the AURALYFT, right along the hairline. So the AURALYFT incisions we hide behind the ear canal here. They come right out again, right in front of the ear, and we're gonna make her earlobe shorter. So this is where we're gonna release, there's a long earlobe, and it's long because the neck came down over time. And we hide the rest of the incisions over here behind the ear where nobody can see them. And this is how you get your posterior neck lift. So this is the marking we make for the deep plane entry point. That's where we go down and release everything in the face. We have something here called the sailboat modification. Because there's a bit of heaviness in the neck here, we're also going to make a tiny incision in here just to do a little bit of liposuction in the neck. So even the incision placement is important. A lot of people don't measure beforehand where it's supposed to go. Alright, so now we're doing the markings for the brow lift. This is a hybridized kind of brow lift. It's a mix between a lateral temporal lift and an endoscopic brow lift. So she has such a nice low hairline that we can put the incisions anywhere. And right now I'm deciding how to do that. So because she has a bit of a heavier forehead, the single incision that I make here might not be sufficient, so I'm going to do one incision here and then a tiny one up there. So as you could have guessed, if you put your face in front of my hand, a mark is going to go across your lip. Alright, put your chin up a little bit. So right now we're doing the markings. She has a natural area here that it wants to go. I put the dot right in the crease where the lip wants to start, and I did the reference markings. So I do about 300 of these a year, so my guessing game is pretty good. That marking I put there, I haven't measured it yet, but I can guarantee you it's 5 millimeters at the top, 5.5 at the bottom. I haven't measured it yet, but that's 5. So as I said, that's 5 millimeters at the top of the dot, and that'll be 5.5 at the bottom. So I can even guess on the height of the dot itself. So now the biggest challenge is going to be doing an upper eyelid surgery through these little eyelashes, through a forest of lash. Up your arm, close. So I got these new marking pens thanks to Jason Bloom, best doctor ever. The instrument I use to measure how much skin I'm gonna take and see if it's safe is the same exact thing that places eyelashes on. It's an eyelash placer thing. So we're done. I'm a makeup artist. I made her look pretty. I gave her a little mustache, gave her some little horns. You're gonna love the new look. Esther Bester is doing the regular health stuff. We've marked up the face a lot, all over the place. We're going to be doing all this stuff to get a little refresh.
Oh my goodness, I'm really going through this.
Yeah, you are. Don't worry, we'll give you drugs. So I'll go through the recovery stuff with you just so you know. The brow lift is going to give you a headache for a couple of days. Incisions are going to be hidden so you don't have to worry about it. Risk stuff is pretty low. You just worry about numbness, which comes back, and paralysis, which won't happen. So the lip part, incisions go right under here. The lip is going to take the longest to heal out of all of this. It takes about 3 weeks to look even remotely presentable. 3 months is when it really starts to look nice, okay? So you got to wait for that 3-month mark. So what you're going to notice within those 3 months is that at 3 weeks, it's going to go from a puffy swelling down to like a firm swelling. You're going to get a nodule or a bump on each side, one over here, one over there, and usually some firmness in the middle. At 2 months, that pretty much mellows out. The facelift part is easy to recover from. The incisions go around the hairline over here. They become very difficult to see. Also, 3 weeks till you look presentable, where if you run into someone in the street, they wouldn't know you did it. So risks that go along with the lip, there really aren't many. You're always going to have a slightly visible incision if you were to spread your lip out. Otherwise, nobody would be able to tell it's there. But you can't say it's really scarless. It's just really, really difficult to see. Okay, the risks of the facelift to think about. You can always have some numbness, and usually this area over here, it goes away. People worry about numbness or malfunction of the nerve that goes up to the corner of the mouth. The risk is less than 0.2%, and that's a temporary risk with the way that we do the lift. There's risk of skin problems, which could happen here, back here. With this kind of modification, it doesn't really happen anymore. The risk of hematoma, which is blood collection, is very low as well. Otherwise, that's it. Do you have any other questions, ma'am?
No, thank you.
Are you ready
I'm
to
ready.
get cut up?
I'm ready.
Perfect. Are you ready?
Ready? Let's do
We're
it.
ready.
Did you sleep last night?
I slept a lot.
A lot?
Oh yeah, that's what I do.
Did you dream of dreams anesthesia
Kinda, a little bit.
services? Alright, so going over the plan right beforehand, the eyebrow here, which is the brow skin over here, is a little low. We're going to get it elevated. We're going to clean up the upper eyelids just above it, lift the lip, and then we're going to do a face and neck lift. So we've made the incisions for the lip lift, preserving the natural sill of the nose, making sure not to ever disrupt it. So right now we're doing an endoscopic brow lift through little incisions in the hairline. This kind of surgery just restores where your brow used to be. It does not make anybody look fake, weird, or surprised. Alright, so right now we're finishing the brow lift. The way that we're suspending the brow up is with this PDS stitch. It goes through little tunnels that I made into the bone to suspend to. So we've done the lip lift, the upper eyelids, the brow lift, we've done the neck lipo, we've done the neck lift, and now I'm doing the vertical portion of the neck lift over here, and then we're going to move on to the face. So right now we're doing the buccal fat release. So since we're in a deep plane, we can actually get the buccal fat out just like that by teasing it out nice and easily. Here it comes. Okay, so this is a nice 2-week indicator of what you would see with the brow lift, face lift, lip lift, and upper eyelids. Can you close your eyelids? So you see the eyelids are still thickened over here, but if you open your eyes, you can't tell that it's there. There's a little bruising, and this is with no makeup, so you can actually see the bruises, and we can laser these to get rid of them today. On the other side of the face, it's fine. The lip itself, you can see is swollen. Here's the incision at 2 weeks. That's how it looks at 2 weeks, so it's healing pretty well so far. But if she smiles, smile big. Show me your teeth. See, so the smile's limited, so you can't really move much. Which is normal. The brow lift, the incisions are hidden up here somewhere. They're right there. You see it's just a little bump behind it, so you can feel this little swelling. That's normal. And the facelift incisions, she covers them just by wearing her hair like that. You can't really tell anything's going on. If she wears makeup, you can't see anything. And then over here, you can see how the facelift incisions are healing. Okay, which is, this is at 2 weeks. It's already hard to, you can't see those lines really anymore there. And then here there's just a little scabbing in there. It's not a big deal, but the rest of it's going away. And the neck itself usually retains a little bit of swelling under there, which goes away. But overall, if she wears a touch of makeup at this point, nobody will be able to tell. Feeling good?
Yes, very good.